All right, we're back with the second half of the show here. We're going to be doing a little run through all the different endocrine glands and kind of what they are, what they do, and then what's their main hormone and its main function. So, first gland that we're going to talk about is going to be the thyroid gland. The thyroid gland, as you can see in the thing, is going to be right in the neck right here, pretty much right below your voice box. And it's a little, almost like butterfly-shaped gland. It's made up of these little follicles that are going to pretty much make the hormone, and then that hormone is going to get released into the bloodstream. What we're going to see is that the thyroid gland actually makes and secretes three different endocrine hormones, one of which we've already talked about, and we'll come to that one on the next slide, but that's calcitonin. The other two it makes are what we usually abbreviate T3 and T4, which are thyroxine and triiodothyronine. Main thing with both of these hormones, T3 and T4, what they're going to do is, I always kind of say it's kind of like the idle on your car. T3 and T4 are the idle on your body. The more T3 and T4 you have released in your body, the faster you're going to idle. So like the same idea in the car, if your car is idling at a higher RPMs, you're going to burn more gasoline. So T3 and T4, if you have more of them, you are going to be using energy quicker. It's a lot of times going to mean weight loss or other things like that. So like it says here, increase of energy released from carbohydrates, increase protein synthesis, increase growth, increase activity in the nervous system. T3 and T4, two of those three thyroid hormones are going to trigger an increase in metabolic rate. It's part of the reason when you get somebody who has hypothyroidism, meaning not enough thyroid hormones being released, it's one of the times that a lot of times people will gain weight without eating hardly anything. The other one that we already know that the thyroid gland makes is calcitonin, which, just to remind you, is what's going to help lower blood calcium levels when they get too high. And this is just kind of showing how it's made. Nothing really crazy important on that slide. Again, kind of shows you that pretty much we're going to be monitoring concentrations. If they drop too low, you're going to get the releasing hormone that's going to act on the anterior pituitary, release TSH. TSH is going to act on the thyroid gland, which cause increased release of T3 and T4, which may bring it back into normal. If not, this will keep happening. If it does bring it back in, it stops it right there. So again, just kind of rehashing the idea of the control and the feedback loop again on this one. Like I said, held in there, they bind to mitochondria, make them burn ATP faster, and again, because of that, you have a tendency to burn way more calories when you have increased thyroid hormone secretion. And again, those other ones produce calcitonin, and we'll leave it at that. The parathyroid gland is these four little spots that are on the back of the thyroid gland. You can see by the picture up on the right here. This is the parathyroid gland. Here's the thyroid. You can see a distinct difference in the tissues here. These are going to make and secrete the one hormone that we've already talked about again back with the bones, which was parathyroid hormone, which was the hormone that was going to be used to increase blood calcium levels. So just to remind you, it stimulated osteoclasts and inhibited osteoblasts. It decreased excretion of calcium, so it increases reabsorption of calcium, and it also increases the intestinal absorption of calcium from the diet. The next hormone to talk, not hormone, but the next gland to talk about is the adrenal cortex. And the adrenal gland, it's the little kind of, I was going to say it looks like the little Robin Hood hat that sits on top of the kidneys, the adrenal glands. The adrenal gland is actually kind of like two glands in one. It has the adrenal cortex, which is going to make the different adrenocorticosteroids. So things like mineralocorticoids, glucocorticoids, some androgens, things like aldosterone are going to be made by the adrenal cortex. And again, you can see it sits on top of the kidneys. Like I said, if it had a feather in it, it looks like a little Robin Hood hat. And there's these different layers to this adrenal cortex, which again are involved with making these different types of hormones. The adrenal medulla is the inner part of this gland, so this part right here. It is going to be responsible for making the different types of adrenaline, so that epinephrine and norepinephrine. This is what's made by the adrenal medulla. The pineal gland, and it is the pineal gland. Make sure you say that one right, otherwise it can be embarrassing. But the pineal gland is actually up in the brain. It is kind of tightly wired to the optical senses. Because of this, it secretes this hormone melatonin, which, because of its relationship to the visual sense, is involved in setting your sleep-wake cycles, also known as your circadian rhythms. But the pineal gland is also involved in kind of dealing with reproductive things as well. The pancreas, as we kind of continue our tour through the endocrine glands here, the pancreas is one of those organs in the abdominal gland. It's an accessory organ, so kind of a helper organ of the digestive system. We're going to see the pancreas is one of these rare organs that is an endocrine as well as an exocrine gland. So the pancreas has some very important digestive functions, which we'll talk about in AP2. But its endocrine functions are involved. It really secretes the two main hormones that I'm going to worry about are glucagon and insulin. Glucagon is responsible for it, and I think it kind of shows you the little islets. They're made in these cells right here. But glucagon is going to be the hormone that raises blood glucose levels by kind of triggering the breakdown of glycogen in the body. And it also triggers what's called gluconeogenesis by the liver, which is making new glucose. Insulin, I think most people are aware of, is the hormone that lowers blood sugar. So insulin does this by, it actually opens up glucose channels to allow cells to take up that glucose. If you take up glucose from the blood, you lower blood glucose levels. And this again kind of showing it all right here. So secrete insulin, increased rate of glucose into cells, increased rate of glucose utilization, convert glucose to glycogen, use stuff to increase protein synthesis and triglyceride synthesis. This is going to lower blood glucose levels. Like I said, the other cells secrete glucagon. Glucagon is going to trigger glycogen breakdown of fats to sugars, and synthesis of new glucose, also known as gluconeogenesis, all of which these things will increase blood glucose levels. We don't really get into much of it here, but just to kind of give you an idea, everybody's heard of diabetes and what goes on with that. Really, there's two main types of diabetes. Type 1 diabetes is generally considered to be an autoimmune disease. This is also known as an insulin-dependent diabetic. What happens with these people, the reason their blood glucose levels are too high, which is the case in diabetes, type 1s, the reason they're too high is because they do not make insulin. The cells that would be insulin-producing cells were attacked by their immune system generally or just damaged overall and are unable to make insulin. This is why they're also called insulin-dependent diabetics. Type 2 diabetes, on the other hand, those beta cells are plenty capable of making insulin. What's happened is the cells have really become insensitive to that, and it has a lot of times to do with being overweight. Your fat cells actually release hormones that will help to inhibit the action of insulin. And as you get overweight enough, it can actually cause you to not take up this into the cells because your cells are basically saying they have enough energy. So type 2 diabetes, really what happens is the cells have become insulin insensitive. You release the insulin, but the cells do not respond the way they normally would to that insulin to lower blood glucose. So your blood glucose levels become too high. The intestines, again, just realize they are an endocrine organ. Same thing with the stomach. We are not going to worry about these in AP1 here. This is stuff I will talk about, or whoever your instructor is will talk about in AP2. Same thing with the kidneys. The kidneys do have a couple different hormones they can release that are involved with red blood cell production as well as blood pressure. But again, we're going to deal with this more in AP2. So we'll skip all over this stuff. The heart, again, can release a few hormones that can really tone down blood pressure. So the heart also acts as an endocrine organ. Discuss that again in AP2. Thymus, it does help mature these T cells, which are part of your immune system. And again, we'll talk about this a little bit more in AP2. Sorry to kind of give you a set of slides in a row that are all kind of AP2 ones, but just realize they are part of this endocrine system. They are endocrine organs, but we're really not going to worry about them in AP1 here. The gonads, though, the testes and the ovaries in kind of males and females respectively, we can do a little discussion of those real quick here because they act as endocrine glands as well. You have those FSH and LH that we said that can act on these gonads. So LH is going to act on the interstitial cells in the testes to produce testosterone. FSH was acting on pretty much the seminiferous tubules to cause sperm production. But again, the interstitial cells in the males produce testosterone, which in and of itself is a hormone. And because it's the testes in and of themselves are also endocrine glands. And most of you, I think, are aware from like sex ed, growing up, or whatever else, the characteristics of testosterone. It's going to give males those secondary sex characteristics, which are known to be true in males. In females, you have the ovaries, which throughout different parts of the menstrual cycle are going to produce either estrogen or progesterone. And again, we're going to go into much greater detail what those estrogens and progesterones do during that menstrual cycle. But just realize they're important in the menstrual and ovulatory cycle of females. Adipose tissue cells, like I said, can release a couple of different hormones that are really supposed to be feedback ones to help control your intake of calories. So leptin, the more fat cells you have, the more leptin should be released, which should actually tone down appetite. And this resistin, that is what I was talking about there, is you get more and more fat cells, you make more and more of this resistin, which is going to inhibit the action of insulin on pretty much all body cells. And again, a normal endocrine system is going to be a lot of these hormones interacting with one another, as we've kind of seen throughout this. You have things like thyroid stimulating hormone, so this pituitary gland that's acting on another one here, which is acting on another one. So you see all these glands really in some way or another, for the most part, are connected to one another and regulated and feed back to one another. So it is, even though they are not connected, it is a system that really kind of functions as a unit.